Langley. I chair the Northampton Council on Aging and have been, along with several others around this screen, involved very much in the city's age-friendly efforts for the past at least 3 years, if not longer. It seems longer, and sometimes it has. We're delighted that everyone is here and is wanting to join this effort, and hope that if you've had a chance to at least skim through the draft reports, you have some sense of where we're going. Becky's going to provide more detail and an overview before we start. And then we're going to be breaking up into interest groups. I know some people indicated interest in a subcommittee, others have not. I think there's still going to be, you'll have a choice an option when we get there, to be able to do what you want to do. Ben, there was a link in the original invitation. There's a link to the report, and it's downloadable and printable, having done that from experience. So I'm going to turn it over to Becky Bash again. For those of you who haven't had a chance to meet Becky, Becky is our organizer, keeps us grounded. She works for the Pioneer Valley Planning Commission, and Northampton's fortunate enough to be part of their service area and part of a grant that the Planning Commission got from Tufts Health Foundation, now with a new name, 32 Point. We learned earlier
Point
today.
32 Health, I think.
Point 32 Health, the other way around, Point 32 Health. And that's what helps funds the commission and Becky's work with us. So thank you, Becky. It's all yours.
Thanks. Well, welcome everyone. And I guess if you could either just put your name and your, I guess, main area of interest in joining this meeting and this committee in the chat, and so we'll have that for later. I'm going to just start a slideshow. Okay. That many windows open. All right. So agenda today, I'm just going to give a pretty quick overview of how we got to the community assessment and action plan. And then really the bulk of this meeting is going to be where are we going? And we have 4 different committees set up. I'll go over those a little bit later. And we're hoping everyone will stay for that part of the meeting and join a breakout room and help us prioritize the actions in the action plan. And then we'll come back together as a group at 3 and report back on what you discussed, and then talk about next steps. So this whole process has been part of the Age and Dementia Friendly designation and planning process. So the town applied for age-friendly designation several years ago and was designated, and then the AARP gives you 2 years to develop a community assessment and action plan. So a working group was formed, and then we gathered data and engaged the community through a number of means. And also, I'm just going to ask participants to just mute yourself if you can when you're joining, if you're not talking. And then once we finalize that report, we submit it to AARP and Dementia Friendly Massachusetts for final designation. And then it's up to all of you to implement the plan. So we're sort of at the point of finalizing this report and looking at how it's going to be implemented. And then going forward, you just want to report any successes to AARP. So our community engagement is involved an initial listening session and kickoff meeting that Northampton Senior Services did back in September 2019. Then they administered the Livable Community Survey, and there was a summary report developed from that. There was an advisory committee group meeting in September, and sort of others were invited to that as well. A couple more surveys, and I know the ADA transition plan also involved community engagement, and we looked at that. And then there was another survey that Northampton Senior Services did about programming post-COVID. We also looked at a number of plans and reports. The city's pretty good about, there's been a lot of planning done so far in a number of different areas. And so we kind of pulled out of those reports some actions or initiatives that support older adults in Northampton and included those in the assessment report. And then we developed this draft community assessment and action plan. I will put the link in the chat a little later for you all to look at it. And we identified some activities in the action plan at a big meeting in May, where we broke into different breakout rooms and sort of tried to identify what are some priority initiatives that the town wants to take in the next 5 years or so. So I should say these action plan, you know, there's a whole lot of things that could be done. We tried to narrow it down a little so it wasn't too overwhelming. But this report will be a dynamic document. It's supposed to serve as a roadmap for initiatives in the next few years, but you can always add to it and amend it as you go. So today we're breaking into subcommittees to decide on the priorities, and then we'll submit the report. And then the subcommittees will continue to meet and revise and update the action plan going forward. So these are the 9 domains of an age and dementia friendly community. It's a model that was a combination of the World Health Organization's 8 domains of livability and then the Dementia Friendly America's 10 domains of a dementia friendly community. So the Mass Healthy Aging Collaborative combined those into this model. And what we did for the report was we did some other combinations. So there's the built environment, which is housing, transportation, outdoor spaces, and buildings. Then the social environment, so that's communication, access, equity, and inclusion, social inclusion and participation, and civic participation and employment. So that's a pretty big area, and there is a lot of interest in that committee based on the registration. And the last one is health and community services and public safety and resilience. And then overall, we're looking at this with a dementia friendly lens. So there is a dementia awareness and inclusion group, which Kathy is going to be leading. You'll see in the action plans that some of the actions really were about developing awareness and education around dementia. So I pulled those out for that group to look at today, but the idea is that the dementia subcommittee will have people on each of the other committees as well, just as a reminder for everyone to consider people with dementia in all of these initiatives. So next, plans for implementation. We had a meeting back in January and we talked about reviewing the report and distributing it to stakeholders. So we've done that, but if you haven't seen it, you can always add comments. This is where we're holding a meeting of the steering committee and the proposed subcommittees to start setting timelines and priorities. We'll seek approval from the mayor with the final report to submit it to AARP and Dementia Friendly Massachusetts, just so that she's aware of everything that's happening and okay with what's in the report. I believe the last mayor did review the report and provided some comments. So, but just as a courtesy, we want to make sure she's aware of everything. And then submit the report to AARP and Dementia Friendly Massachusetts and set regular meetings going forward. Also, we want to engage additional stakeholders, and you'll talk about that in the breakout rooms. It might be local people, regional state partners, and other residents. And then just reporting on successes and challenges going forward. So as I mentioned, the action plan, this is an example of the health and community services action plan. I colored in purple the actions that we pulled out for the dementia subcommittee to review. So if you're in the health and community services group, you can skip that one, or if you really think that's a top priority, both groups can focus on it. But I'm just wanted to let you know that the Dementia Friendly Committee is going to look at those. I also wanted to briefly mention that there is a project that was funded through the Community Compact Program, where the city's hired our organization. So I'm going to be working on this with another colleague. And the action that we put in there was reframe the narrative about aging and dementia. So really what we're going to be doing is sort of a regulatory review, but also looking at, how the town, the language that the city uses for various policies, plans, reports, programs, and practices that serve older adults. We sort of started on the regulatory review track, like reviewing zoning. I have a colleague who's doing that, but Northampton is doing a major zoning change, which involves form-based code. So we don't want to get into that too much if there's already a big document in process that's being reviewed, although we can review that draft document. So that's something that's happening, and this action's under social environment, but it will also cover some other activities like looking at the snow removal system and policy, looking at how the DPW prioritizes sidewalk maintenance and replacement. So that will sort of be all part of that project. So the 4 different subcommittees are Dementia Awareness and Inclusion, which Kathy is going to lead. Cindy's leading Built Environment Subcommittee. So again, that includes housing, transportation, buildings, and outdoor spaces. The Social Environment Committee is being co-led by Linda Desmond and Mike Ford. And then Health and Community Services, Public Safety and Resiliency. Carolyn Sandell is leading that group, and we are looking for a co-leader. So if anyone's willing to help her with that, Carolyn's fairly new to the community. So we're hoping someone who knows Northampton well can join her with that one. And so the task of the breakout groups is really look at the action plan and help us prioritize. So we're using 3 levels. So high priority would be sort of short term, next 1 to 2 years. You want to try to do this. Medium 3 to 4 years, and low 5 or more years. You can add if funding is required. So, just use $1 or $2 signs, or 3 if you think it's an expensive project. That might indicate that you'd have to apply for grants in order to move that project forward. And then think about, are there any priority actions missing? And we don't want to go back to square one and start brainstorming actions, but if there's anything that someone in your group is already working on through their organization, or knows something that's happening, or thinks that there's something that's really high priority that should be in there, you can add those to the table as well. Also think about, are there other people that you want to invite to be part of your subcommittee, or content experts you want to consult with? If you have time, I think 40 minutes is going to go pretty fast. So, but that's something to also think about. And then decide when and how often your group wants to meet. So we can try to set up a next meeting date, or if there's not enough people who are interested in one committee, you can decide this isn't, we don't have the capacity to move these items forward. We can prioritize them as medium or low, and think about who to try to recruit to do that work going forward. So there's not a lot of, we don't want to put a lot of pressure on anyone to, this has to be done, but this is really sort of supposed to be a guideline for you to start to move things forward in Northampton. And I will try to copy all this into the chat just so that you have it when you get into the breakout rooms. And I'm gonna stop sharing for now. Let's see, hold on. So, okay. So now, does anyone have any initial questions? And if not, I'll start putting you in breakout rooms. We're actually, I set it up so you can choose a breakout room. So how it's going to work is once I open the rooms, you should see a window on your screen and it'll have the 4 different committee names. And you have to just click on join and that will put you into a room. And I'm going to stay out in the beginning, but try to make sure each room is all set up. And then I'm going to join Cindy in the Built Environment Committee. And I'll just say that we have a lot of people signed up for the social environment. So if there is interest in health and public safety or built environment, please join those. Even if you aren't sure if you're going to, keep with that with a subcommittee going forward, it just helps us to talk through some of the prioritization. I'm going to stop now. Let's see. I'm just looking to see if any questions. So Ben asked if should new folks join any particular room. It's really up to you. And like I said, we could use more people in the built environment or health and public safety. But if you think that you do want to join these efforts going forward, think about what's of most interest to you and what you would want to work on. If you're not sure, join any committee you'd like, but we do need more in in the health and built environment. So any other questions right now? You can feel free to raise your hand or unmute. George.
Yes, if we there's a couple rooms that I think I'm interested in. If I jump into one, I feel it's not what I'd be best in, I can jump into another?
Yes.
Okay.
Theoretically, it does give you that. I haven't tried that, but it does give you the ability to do that. And if anyone's left and you haven't seen the window, I can also put you in a room once we open the rooms. So any other questions before we break up? Okay, let's see any. Okay, so I'm going to open the rooms and then just click on. So you should see a window that says join or shows all the rooms, and just let me know if you don't see it.
Not yet.
You don't see it? Okay.
Not yet.
I can put you in a room too. Let's see.
You have to click on it. Click on breakout.
Yeah, you have to
room.
click on join.
I'm not seeing anything to even where there's a join option.
Okay.
You
I'm
have
gonna
to
put-
go down to the bottom where it says
There you go.
breakout rooms.
Oh.
Got it. Thank you.
I'm on an iPhone. Oh, I see. Join breakout room. Got it.
Is anyone else having problems? I can also put you in a room if there's one you're interested in.
Yeah,
Let me-
Yeah, this is Diane. Becky, can you
Yep.
put me in health and human safety, please?
Sure.
Thank you.
And this is Tyga. I'm on an iPad and I'm not getting a join. I'm not seeing it on my screen.
Okay. And with you are going to be in the dementia one?
Yeah, if you could start me in Kathy's.
Yep.
Right,
Okay.
thanks. Okay.
And George, which one did you want to be in? Oh, you're muted.
I'm trying to decide between health and public safety and social environment.
Okay.
I'm
And
interested in
Michael, I'm
both
going to
of
put you in social.
yeah.
There you go.
Okay.
Oh, and Sharon, you're muted. Which one did you want to be in?
Social.
Okay. Okay. I think we should be all set. So do you see a button saying join? There you go.
Summarize the report for you. So You can go back and read in more detail. A lot of it helps you understand how we got to the point we got to, where the draft recommendations. Hi, Jeff. Welcome.
Hey, I was in the health and public safety, but my coworkers are there, so I split up.
That one looked heavily CDH.
Yeah. it was.
Great.
You're
Okay,
welcome. Happy to have
so
you.
I can share my screens and, or does everyone just say hello briefly? Stephen, I don't know you. Where are you? Are you in the health department?
The public library. I work at Forbes.
Library.
I didn't, I chose this because there were fewer people here, and I thought that if I were here, then there would be one more person either listening or possibly talking. But I could be anywhere really.
No, please stay with us.
Yeah.
I'm interested in all of it.
Please
So
stay with us.
Okay.
sure. Thank you for that welcome.
Yes.
Yeah.
So I can share my screen and we can
Thanks,
start
Becky.
looking at it.
I think we realize that even at the end of today, there are going to be a list of priorities, and prioritizing the priorities is going to be a challenge. And it may be that there may be just some areas where it's more important to start or it's easier to start.
Yeah.
So there may be some overlap in areas of interest.
I'm just gonna go ahead and start, Cindy. I'm just gonna put what we're
So
supposed to do in the chat too.
Please let us know. So in the lead partners, there are a number of abbreviations. So if it's not obvious to you, DPW is Department of Public Works, Northampton Senior Services is NSS, Northampton Neighbors is NN, Planning Chamber, I think there's PVPC is the Planning Commission. What we did in this first iteration is come up with the strategies, and then who are likely individuals or organizations who should be involved in some way, shape, or form. So we don't necessarily expect, or that would be ideal if someone from DPW wanted to be on this committee, but clearly for a number of these improving sidewalks, they're a key player. And also I would just add, and I think Becky was alluding to it, so there's no money comes along with being an age-friendly community. So there obviously are grants, hence the grant that got Becky to be part of our family. But a lot of this, I think, is helping, trying to influence being an advocate for priorities and looking at where are, it's the phrase of low-hanging fruit. Where are there areas that we think we can make some progress? Does that help provide a little bit more context?
I'm not quite sure how to translate the idea of a timeline to a priority.
So, yeah, I think it's more like priority for starting. So, what's the group's priority? So it's more like, what are you going to do in the next 1 to 2 years versus 3 to 4 years versus 5 or more years. So I will say that, sidewalk maintenance and replacement and snow removal, those are two things I think we were going to look at the city's policies as part of this community compact work. So we might say that's high priority because we're going to be working on it soon.
And I think, and also just using that same example, Northampton Neighbors, certainly now that we're out of the dark parts of the pandemic, at least for the moment, has volunteers who are available who could in fact shovel a person's walk or driveway if they themselves weren't able to do it. So a lot of this is there are services and support in place. It's just how to communicate that, because it's either you know or you don't know. There's not a lot of shades of gray, and often people they have no need to know unless it becomes they're in need of a service.
There's also the difference between policy and practice. For example, we have a pretty strict policy laying out consequences for unshoveled
Yes,
sidewalks that is very rarely turning into anything being enforced.
Mhm.
Right.
Well, and I would say, Steve, to that point, and this is my opinion, but I think some of this is also influenced that we have been designated an age-friendly community. And what does that mean? And part of that may mean that we need to get more pressure, if that's the correct word, on folks to be sure to enact that policy, you know, be more diligent. And how can that happen? Those kinds of things. Becky referenced earlier needing the mayor's approval before we submit this. We also need the mayor's involvement because some of this is the expectations of a leader.
Right. So this is something I've done work with the Downtown Northampton Association. I was on the board there and I was in a different capacity than the library, but well, actually included the library. But the idea of kind of the chasing of the mayor's interest by provoking interest in the community and getting the community to speak to the mayor kind of thing often feels like everyone's moving at the same pace, so no one ever catches up to anybody else. But it has me thinking about, like, we have the Disability Commission of Forbes Library, but there's also Northampton's Disability Commission, and they're like an advocacy group that has like a strong vocal board, and a lot of overlap, I think, in the same physical needs in like navigating the community. So
that's a good point. We should definitely include folks from that commission.
Yeah, Jeremy Dubs is the I think head chair.
Okay.
Yeah, he's in the planning department. He's a strong partner in this effort.
Jeremy Dubs?
Yeah.
Okay.
So I think, and again, part of this is educational, and it's also, I think, a framework in which to ensure greater coordination amongst folks.
Jeremy McComber Dubs. I'll put it in the chat.
So,
and I think who you're thinking of in planning is probably Keith. I don't know if he says Benoit or Benoit.
Benoit,
who is the ADA coordinator, and therefore, while he is not chairing those meetings, he is present at all of them in an official capacity.
Okay. So yeah, definitely. So they should really be involved with the snow removal and the sidewalk.
Yeah, throughout. I mean, we've got planning. I think planning there. I think maybe that was the umbrella we were thinking about, because he gets a member of the planning department.
Yeah, but the disabilities committee would be a good.
The committee itself, yeah.
Commission.
I think, Becky, you said it earlier, when we think about build, priorities always come down to housing and transportation. And we know that there's not enough of both.
Right.
Certainly.
Well, one thing Carolyn Mish noted was, the city has these, the Complete Streets Prioritization Plan and a Complete Streets Design Guidelines, and requires certain things of developers. And so the question is, how is the city complying with those guidelines, those design standards, where, the same ones that you would require a developer to comply with. So I'm not quite sure how we're going to review that, but it was one thing that came up in our regulatory review discussion.
Other thoughts, we look at these, we've got, there aren't that many.
Put this under here too.
What does CC mean?
Community Compact Project. That's the one that we're funded to work on. The PVPC is funded. So it's a state program where the city said, we want to do an age and dementia friendly initiative, and so there's funding that goes along with that.
Okay.
And it's over a 3-year period, correct, Becky?
Yeah.
And it was, Jeff, it was sort of if we're going to reach out and consider ourselves an age-friendly community, why don't we start at home? Basically with the city's own departments, and practices, but both with language, customer interactions, etc. So that's what that's all about, to really look at taking a look inward at city services.
Thank you.
So the other ones we have are, so increase tree plantings, add seedings. So those could be, what do you think, medium priority or?
Well, isn't there another group that's already working on that? I know in my neighborhood, there've been a lot of trees planted by, I guess, the Tree Commission.
Okay.
Yes, tree. You're right.
So even if it is a priority for us, if others are already doing it, then
Mhm.
That may be one of those areas to coordinate with what's their priority
Yeah.
list look like.
I think so.
So yeah, maybe just add that.
Also, it's interesting to consider like which sidewalks, like there are places that don't have sidewalks at all.
Yeah.
The Chamber of Commerce and the Downtown Northampton Association, do a lot of advocacy for downtown things, but just like residential, I feel like so I do a lot of walking, and I kind of have to, it's basically just the fact that I'm able to walk the shoulder of a road, or so it's kind of takes some daring, in fact, and
Yeah.
I think, I would advocate. I love the idea of just having sidewalks where that is a assumed mode of transportation from one place to another, and that might be something to consider. Just like what what does it mean? Like, where do we want sidewalks and for whom? And if there are places where there aren't sidewalks, but there are people, I don't know, that almost feels like its own kind of like thing to analyze or whatever.
I
So
agree, and I would connect it to, don't we have a Complete Streets initiative? Through
yeah, there is
Sustainability?
there's a complete streets prioritization plan and a complete streets prioritization. It's there is a document that has a map of all the sidewalks and priorities and stuff. So I guess it would mean reviewing that and sort of seeing, does this jibe with, but there was a big engagement process around that. So
that's great. Look at us.
That inventory was pretty recent. I feel like just a few years ago, and they went, and for every road, is there a sidewalk? How big is it? What is the slope? What is its condition?
Yeah.
So we know where the problems are in terms of what's there, knowing how that meshes with like traffic patterns and where the people are. I don't know if they have a great sense of that, besides the intuitive, like, oh, near businesses, there's more people. But they definitely know where the problems are in terms of the infrastructure.
Yeah.
That's like important questions. I think some of the early discussions, even though our lens is on age friendly, it's not just looking at people, older adults, that having a city that has adequate sidewalks for that mode of transportation benefits everybody.
Absolutely.
Yeah, this seems like this street initiative seems like a great resource to kind of to reference.
Mhm.
Um,
Yeah, and I think it's referenced in the report, but yeah. One thing that comes to mind is that some cities have like a number you can call if there's an issue with your road or your sidewalk, and so the city puts that on their list of, maintenance issues. So that was one thing we were going to look at.
Yeah, and I think that exists in Northampton. How well publicized it is another question.
I Google searched it and found the draft of it or whatever.
Yeah, so through the planning department.
So I wonder if these initiatives that have already been kind of kind of rendered for us, or, you know, like if leaning on those could help determine a priority, or at least make things easier to talk about, I guess, because they're already.
You know, it seems to that point, Steve, it almost a conversation with the planning department has oversight for a number of this, as does DPW. And it's almost a conversation. Here are the priorities we identified. Where do those fit with current initiatives, current plans, et cetera?
Yeah.
And that's a fairly straight, I mean, that can be done, that I mean, not straightforward. It's very straightforward. It doesn't requires people's time, but it's not doesn't require money.
This is an interest, I've never thought about this, but what would the odds be of finding someone who administers the Department of Public Works and having them on a commission of some sort?
Well, they were invited.
Yeah.
They were invited. I think again, I'm very clear about making an ask of the mayor that we really need to have somebody, you know, at least for this part of our work, we need to be, you know, have you identify, or have the DPW head to identify somebody. That's what I was talking about, the role we can get from the mayor's office.
Sure.
Yeah, so yeah, and looking at this too, you know, what could this committee do? And some of it is just, you know, at this point prioritizing, making sure that the DPW has this report and say, hey, this is identified as a priority.
Yeah.
But then if you think about, you know, what this committee could do, distributing financial support information, you know, that's a communication thing.
And building on it, I think some of that stuff, some of that stuff is in place through the senior center. Maybe a question of reviewing what's available and pulling it together in one place and making sure that other entities, because not everyone goes to the senior center to look for this kind of information.
Okay. So just looking down here, are there any, let's see, any that sort of jump out? So we have increased bicycling opportunity. Well, connect people with contractors. So again, that I think that information's available at the senior center. Is that right?
I think so.
Yeah.
Although these days, finding an available contractor at a reasonable price may be the biggest challenge.
Yeah. There is there's a guide for people who want to do home maintenance that LifePath created for, you know, just sort of step-by-step how to find a contractor. So that might be other information that could be provided.
Yeah, I just meant that, you know, given the pandemic overlay, that world is gone to hell.
Right. And yeah, so providing instruction and demonstration for bike use and rules and courtesy, work with landlords on housing authority to ensure.
This may be where there's help of having someone from community action.
Yeah.
For all these ones that are kind of connecting people, trying to make sure that the people have the information about a program that already exists.
Yep.
I'm kind of tempted to say that those are fairly high priority, not because they're the most important, but because why would we delay doing them?
Right.
Like,
and they're easier. There's some of that low hanging fruit.
exactly.
It's not program development, it's program coordination.
Yeah. Just seeing if there's any more of those. So there's distribute information about how to downsize and find available housing options. That's
the landlord one seemed close, although I don't know what infrastructure might exist for reaching those folks. which might make it a little harder
Oh,
to work with
land-
landlords.
Yeah. I guess it's a more of providing information, I think.
Mhm.
Yeah.
I think there's a question there of the planning commission, maybe Highland Valley and the senior center about their perspective. Do they see people, are they able to connect people with these services if they're made aware of someone who's got an at-risk housing situation?
Mhm. So should I put that high or medium?
Yeah, in my limited observation, most high at-risk housing situations have a lot to do with economics.
Yeah.
And in many cases, those folks are already clients of one of the organizations for other reasons.
So just going back, instruction and bike use. I think part of that is just reaching out to Friends of Northampton Trails and
Seeing what's in place.
yeah.
And I know we do want to focus not only on Valley Bikes, but they've expanded just in the past year, expanded not only their locations, but they've kept a lot of them open during the winter for the first time.
Yeah. Do you think that's a medium or a high? Medium.
I'd vote for medium.
How about the benches and the seating? Is that medium?
I'm tempted to say medium, though if we're just doing high, medium, and low, it's not a lot of granularity.
Yeah.
I do think that they really represent something important, which is that having a walkable community with no place to rest is only walkable for people with lots of energy.
Right.
And if you can give someone a place to sit down, rest, orient themselves, it becomes walkable to a large number of people it wouldn't have been otherwise. On the other hand, if they're going to fall off the sidewalk because it's so badly damaged, it doesn't matter if there's a nice bench.
Right.
So.
Oh, and it's a question also of looking at benches. To your point, there certainly are more benches downtown in both downtowns. There aren't as many benches in other areas that may be walking versus, I'm downtown shopping, eating, or whatever.
Mm-hmm.
Yeah. And actually, yeah, I mean, this will probably come up in parks. Well, sidewalks, yeah.
Yeah, I mean, my instinct is that while bench density should be greatest downtown, they should not be limited to downtown.
That's where my head was going to.
Yeah.
Well, I think like even in terms of like a city planning, it's like everywhere has the chance to be a place to like enjoy, I guess. Like that benches not only are there to
I wonder if
like
there's
anyone like if you put a chair anywhere, that's where someone will sit in a chair that you put anywhere. But the idea of like punctuating a cityscape with benches that serve the purpose of rest, but also like I don't know, reverence or something like that. Like, and maybe that's like an aesthetic that doesn't need to be like brought to this meeting necessarily, but I just
I wonder if there's a bench inventory, there's a sidewalk inventory, if there's a city, just a public bench inventory.
Right, or like city beautification kind of stuff where like
just to know where they are.
Yeah. There's not always, that's a good point.
And also like what are the destinations? Like what are the paths that people take and why? If knowing what the path is.
Interesting, and the Chamber of Commerce would hate me for saying this, but there's not a lot of activity downtown. Because our downtown is a destination for recreation more than essential.
Notice that counting down. You don't need to worry about.
Can you still see my screen?
Mm-hmm.
Okay.
But there's someone's I can hear stuff that isn't us. But I don't know. Maybe it's
Sorry, I will mute. It is very noisy in the library
Okay.
upstairs.
Sorry about that.
You have
That's good for the
benefit of
library.
Yeah.
Yeah.
Okay, so it's just,
I apologize. I had to take an urgent call for a second. Would you mind scrolling so I can just see what you did?
yeah, so we have,
Yep. Hi, medium.
And with
Hi.
and
Yep,
adding a lot
gotcha.
of
Okay.
Yeah,
Thank
we
review
you.
sort
of
of been
existing, coordination and review of existing entities
Yeah.
in there, which is why they got to be high.
yeah,
Yeah. At some point, we might have to go back through because if everything's high, then nothing
Yeah,
stands out.
exactly.
right. Let's go down.
And not
So,
to add,
Put the
not to
bikes-
add or open a can of worms, but I didn't notice in this digital access, like connectivity.
that's under communications. Do you
Oh,
think it
okay.
should be in this one too?
I didn't know where it was, so as long
Okay.
as it's somewhere.
Yeah, no, that's an important one.
But that, it's what I think is important aspects, and maybe that's where your head was going, Jeff, about the city's movement for its own internet.
I wasn't necessarily specifically going there. I was just thinking we had
Okay.
to flag it to make sure it's showing up somewhere in the plan.
So how about collaborate with social service agencies to integrate services into housing authority properties? Is there anyone doing that?
We tried at one point on a project. It proved to be pretty challenging.
Yeah,
I would say I would rate this very high just because it's
okay,
I don't think it's that promising. I think it's a good idea, but
so maybe low.
I think it exists in the world where it's done individual by individual, but it doesn't. I mean, 5 years ago, the Housing Authority had their own social worker on staff. So that helped provide that connection between the residents and other organizations, and that position no longer exists.
just in case this document is shared publicly, maybe we could not say difficult.
Expensive. Let's see, low but important.
Time consuming? I don't know.
Logistical challenges, maybe?
Okay,
Yeah. So I guess in part of this is to try and, is there a problem that needs to be solved? Are residents of the various housing authority buildings not getting services? Or some are, some aren't. It may be a mixed bag.
does Highland Valley provide services? Because I know in some areas like West Mass, Elder Care has a staff person who works at a housing authority property. And so it's kind of, they're the service provider for, certain income levels. And they're right there. So,
Not to my knowledge, but I think Highland Valley likely has a number of clients who live in the housing authority properties.
yeah,
But so that's why I was making reference that I thought it was individual by individual.
okay, yeah,
My guess, and it's just a guess, but is that the reason this was written this way is simply because we would expect the housing authority properties to have a high density of vulnerable folks who could use these services.
Yeah.
If any way we can reach those people would be good.
Well, you're right. That's a really great point. Maybe we should raise this to medium.
yeah. And actually, there was someone who was gonna come who just started a tenants association at a housing authority property.
Yeah.
Yeah,
I think in here, one of the things in here that's important is to get a better understanding of what the current situation is.
yeah,
Mhm.
There's also maybe this is a chance to maybe address intersectionality of people with different financial access or I don't know, different social who making sure that this initiative isn't cited towards one class over another or something like that, making sure that the opportunities that arise from that, the acts that this initiative like fulfills isn't like it's accessible to anyone or everyone, and maybe even getting past some obstacles that are there because of class or because of like financial difficulties or something like that, if that makes sense.
So
It does, and certainly
yeah.
those residents of the housing authority properties are all in a relative, a low income situation, because that's one of the eligibility requirements.
Does that
So,
ensure inclusivity? Does that?
right, but there are also people who are living elsewhere in the city where income isn't the issue.
Yeah, definitely.
Right.
Awareness and accessibility.
Yeah. So it sounds like, I mean, getting an understanding of the situation, that's a good place to start. And then, so we have about 10 minutes left. How about providing support services through Northampton City Managed Services to help people sign up for affordable units? So that's there's a statewide list you have to sign up on.
Yeah, that is an ongoing service at the senior center. The challenge here is the waiting list is forever.
Yeah. Okay.
I guess the question for me would be, what if anything is in place for someone who qualifies to live in one of the housing authority properties, but is on the forever waiting list?
Right. Yeah. So
What happens in
identify
the
resources.
meantime? Yeah.
Okay. Information about how to downsize and find available housing options.
I would put that as low. I think there are people who do that, but that's a case where it's identifying what's in place, because that usually is a situation where income isn't an issue. It's more
right,
needing assistance.
Yeah, and these alternative living options, I just had a discussion and with another community that was looking into vetting students who are looking for housing to live with older adults and help with some basic tasks, or home care type things. And sharing houses or apartments, I think that's allowed in zoning. It's just a question of like, what are some models that are out there that you can.
Cambridge, I know for sure, I've been reading about it. Cambridge has a program like that in place.
Okay.
Which, given that Cambridge, I don't know if it's Boston, but I think just, that may be with, reaching out to the colleges and their housing offices and see whether, this is something that would be a viable option from the student perspective.
Okay. Should I put that low or medium?
I'd do low to medium.
Okay, available transportation services. That seems like a high one.
Agreed. And hopefully not difficult.
Yeah. Yeah, the PVTA will do like an orientation and okay. Train volunteer drivers through partnership with the Alzheimer's Association.
That may be an opportunity to pursue with Northampton Neighbors, since they seem to be the largest grouping
Yeah.
of volunteer drivers.
Yeah.
I'd like to understand that a little bit better. It's one thing to drive someone from home to appointment or whatever, but once the patient or the person gets to wherever they're going, does the driver just wait in their car, or do they help them?
That is a good question.
I'll give you a quick example. I have a family
Yeah.
member who drove themselves to their doctor's appointment, went into the building, and then couldn't figure out where to go from there and had to call for help.
Yeah.
So I think for some people, this will just be more than just the transportation.
That's a really good point. Yeah, especially people with early stages of dementia who don't have someone who's with them. It seems like that's an additional need.
So it might be worth inquiring, starting with the Northampton neighbors, is what is their practice?
Yeah.
Mhm.
I can definitely see, particularly when it comes to commercial drivers, a taxi cab driver, a PTA driver, someone who has scheduling and financial things constraints, the amount that they can do to help someone is somewhat limited by all their other obligations. They might recognize here is someone who I think is going to be struggling. If I just leave them here right now, it's going to be a problem. Is they should have an easy, this is what I should do in this case. This is who I should call.
Mhm.
And also maybe there's something like people could be screened out if they really can't navigate on their own. They probably
Mhm.
shouldn't be using these transportation services.
Um,
They need plan B.
Or that, working with that individual to find a companion to be with them,
Yeah.
So,
whether it's
real quick,
a friend or family member or a Northampton neighbor volunteer.
just like one of the things that kind of seems like it's come up, and I think with all of the when things engage other people, like it's becomes like having other people who are either there formally or people who are there voluntarily, like the housing authority, like whatever logistical problems there might be at, like, say the McDonald House or something like that, getting information to someone maybe because they don't want to talk or don't think that they have a problem or anything like that. Like putting people in the places where we're having, like where those people might be needed, seems like an overall kind of possible solution or something like that. Like where like safe space might include safe people.
Mhm.
Good.
Thanks for listening to all that. That's
That makes sense.
Good. So we didn't decide on a meeting, but I'm let me just stop sharing. It sounds like, are you guys interested in being on a subcommittee, or are you just joining for today?
I'm interested. I don't know what I don't know what I have, but whatever I got, you can have it.
Okay.
I probably have too much going on to commit to one more thing, but I'm around
Okay.
if it's ever useful.
Okay. It looks like the breakout room time is up. It's 3 o'clock. So I guess we'll go into the main room now.
Okay, thank
Okay.
you.
Thank you.
See if there's still. Oh. All right, some people are still in their room, so I'm going to give it a little more time. There we go. Welcome back, everyone. So if it was anything like the room we were in, there wasn't enough time to go through all the questions, but that always happens. I guess why don't we start with reporting back what you discussed and what, if you made any decisions, and if you decided if you're going to meet again. So why don't we start with Kathy? Oh, you're muted.
Hi, everybody. Thanks. Oh, my goodness. I mean, a couple people didn't show up that were supposed to show up, but it's fine. But we had a great group. Those of us were there looking at the, all of the activities. And a couple of points we wanted to bring up is that, we can see this a start on everything, but we're going to need other partners. For instance, the issues around transportation. I do know that MCOA has a transportation program. Also, Alzheimer's Association has a specific transportation program for drivers. Betty Lynn, who's also part of Northampton Neighbors with me, I need to find out what our drivers, when people volunteer from Northampton Neighbors, what education they have around being dementia friendly. So that's one area that we can pursue. The transportation would be an important part of making all transportation dementia friendly. The other around the activities is that we looked at people that are missing and that we don't see here are people from the arts community. And we know that the arts are really a failure-free and positive activities for everybody. And Northampton is supposed to be is a big arts community. And Betty Lynn also offered, because we have venues, that we could be working with the different venues in terms of doing training around being dementia friendly and having their volunteers, their ushers, et cetera. So Betty, I'm going to be pursuing that with her. And I've already talked to my connections at the Arts Council, maybe in terms of making, looking at arts events in terms of making them much more dementia friendly. Most of our actions have to do around education and trying to destigmatize dementia, which is that's a national, international issue. So we were talking about that. We also, thank goodness, Tega, who's a friend, I'll say, and a colleague, has just left the retired from Smith Museum of Art. So we talked about having programs at the Smith Museum of Art, and she's already aware of that, and already had talked to Megan LeMay at the Arts Council, I'm at the Alzheimer's Association, about being trained. And so we talked about that, and been also in any of these activities is in terms of training or having people from like volunteers in the community, like Northampton Neighbors, having people who are trained as dementia friends participating and being and being just helping to be guides, like at the museum. Or, one of the things that I talked about is memory cafes also figure largely in the some of the actions. So I already have, somebody had emailed us from Lathrop House who's interested in starting a memory cafe, but I don't think she totally understands all it means. So I will work with her, but we could have, say, for instance, somebody from Northampton Neighbors, once a month, if we have a memory cafe, could, because a lot of memory cafes really depend on volunteers helping out with that. So we can pursue that for sure. So, and the other thing, what was the other thing I was thinking about? Businesses. One thing that also, we don't have people from the chamber, although Diane, if you remember, when, I routinely do Dementia Friends training, and we were meeting with Amy Kaelane and other people from the chamber, but these are hard times. Let's face it. One of the things that we all discussed is we're going to have to enable and not be a burden or something on. How can we work and be the people to kind of maybe modify, not really modify, but work together and make it so it's easier for these organizations, whether they be businesses, whether they be churches and things like that, to make their settings dementia friendly. So it's partnering with people, and how can we do that? I mean, Tega talked about that in terms of the museum. And so I think we have some tangible activities to do. I'm trying to think about, oh, but the business thing, because one of the things is that there is, as just to let you know that the process to becoming a dementia-friendly community is a little different. It's sort of overseen by Mass Councils on Aging, so they have a different process, and so they have a sort of signing a pledge, et cetera. So I can go over that with Becky and with other members of the committee. But the one thing that is truly missing, and I was hoping Sharon Levinson was going to be coming in, because we need somebody who is living with dementia to be either not necessary to be on the committee, but to be our expert consultant, to be somebody who can kind of help guide us when we decide activities and things like that. How do they understand and what did they do? There was somebody who came to our community forum, and unfortunately I emailed her husband is living with dementia, and I hadn't heard back. But I don't know people. I mean, I have some ideas, but in terms of getting somebody who would mind being who has that awareness and is willing to kind of help us out with this. So I think that's one thing. We do need somebody who is living with dementia to be a part of this group.
Kathy, I was going to say too, we didn't actually mention this in our group, but by having someone who's living with dementia as a and their care provider, because they could relate incidences within our community when they're out in public situations, business, the arts, whatever, they can relay personal experiences and how that could have been, a situation might have been handled differently,
Right.
Yeah.
And that's helpful. I think, nothing is more powerful as in terms of dementia friendly when you're with people who can articulate and tell you, like the dementia friendly training, the videos, and I've taken this course with the University of Michigan, about, when you hear people talking about it, nothing is more powerful and as meaningful as those kinds of event situations.
Yeah. Thanks. Also, sounds like a great discussion.
Oh, it's great. We had good people.
Cindy, do you want to report on our group, or do you want me to?
You've got the priorities. That's my challenge. We can both do it.
Okay.
So we had a small group, and we had a number of ideas and strategies, and I think there was some of them is we need to understand what the current situation is and understand who else needs to be involved. There's several of them, access to sidewalks, et cetera, require someone from DPW. A lot of the city has a heavy hand in some of the harder pieces. So looking at when we set the priorities and using the mayor's influence where it's appropriate to use it. And we talked about transportation issues and looking at where we can, again, get a better understanding of what's in place, how we can advocate better, and a clearer understanding of one of them of what Northampton Neighbors is able to do or not to do when it comes to dropping an example of someone who to an appointment who should not be alone, and is that a driver's service, et cetera. So there's a number of questions. I think some things we put as high priorities because they seemed easier to do, and a lot of low-hanging fruit coordination of information. We clearly are not going to solve the absence of affordable housing in Northampton tomorrow or even next year, but making sure that everyone understands what the options are that are in place. That's it. Anyone else has sort of captured all, Becky, do you think?
Yeah, and part of the community compact project that we're working on, again, will be sort of looking at town practices and programs like the snow removal and the how the city prioritizes maintenance of sidewalks, and sort of looking at the Complete Streets plan and the Complete Streets guidance document to make sure the city is really implementing the program as it's planned and as is required of developers that do new developments. So sort of just getting a better understanding of how that's working. Yeah, and then and then there were a couple of high priorities about distributing information about home loan modification programs and connecting, how to connect people with contractors to do basic maintenance. We had those as high priority, just as sort of more information sharing of stuff that's already out there. Okay, how about group 3? Linda, do you want to?
We got 3/4 of the way through. I don't know. I'm just applauding all the other groups if you really were able to address all the issues as thorough. I mean, please, we really do need more time. Anyway, the next time. We did discuss in the first section, it was in the resource document, and everyone's in agreement that a complete, all-inclusive resource document is necessary, and that it would be nice also to put together a reduced document, like a 1-page, 2-page flyer that we can get out into the community more readily than the 30 or 40-page resource document. And it also, because we can continually update the various changes in the programs that are being offered for our cohort, but it happens so frequently that most of this will have to, this type of information needs to be online. So we had a basic discussion of how we are. One of the thoughts is to have, not only a small little flyer, but also have like kind of a welcome packet at the Chamber of Commerce or at the banks, or, some places that you don't necessarily think of reaching out, but obviously older people do go to those organizations, and it would be a good place to get the word out. One of the things that Sarah suggested about it, is she talked about a little bit about Northampton neighborhood circles. And I don't think that was part of the plan within the action plan. And I think we might try to introduce that into the action plan, because how more you really can't communicate or offer services better than being a good neighbor. And I think we should really consider that direction too as we develop. Let's see, and we did spend some time on the computers and our IT programs, and we're all in agreement that let's get everybody together that does one of these IT programs, like the library, the senior center, and Northampton Neighbors. It's pretty impressive. I mean, I get to talk to people who are wanting and needing computers, and they have stories, and the stories reach my heart. And let's make this even a stronger program, and by getting people from the library together, and Northampton Neighbors, and the senior center, and fill in all the gaps so that everyone within our community can have a computer. And once we get these people together, I think we could, all of these leaders in each of these organizations together, we can also talk about creating a stronger intergenerational component that could actually help to educate people that need to know what Twitter is, myself included. Okay, and how to, oh, shoot. I knew it was only a matter of time before the dog started to bark, but anyway. Let's make, there's some pretty incredible things going on, but let's break down the silos, bottom line. And that not only with computers, but also with aging issues. Know that Northampton Neighbors is there. We can fill in some of those gaps. And we have been doing that, but we could do it even more. And some of the things, another thing is just the amount of outreach we need to do as a community. And that's to, again, get out to the banks, get out to the realtors, but also, have those articles in the Gazette. And everyone is talking about the beautiful article that was in there the other day about the Amherst neighbors. And, we should be able to get that out there. And again, Sarah presented the fact that, our IT program is going very well, Northampton Neighbors, but we need more computers. So let's get the word out, because we have a very giving community, and I think those computers can come together. And the last thing is the strength of the group was that they really wanted the to be all inclusive and equitable in our presentations. And that includes social equitability. And one of Sarah's suggestions that I thought was really good is to ask the city for supporting having a Wi-Fi access in all of the housing programs, so that we can make sure that everyone is just, we can give you the computers, but you can't afford Wi-Fi access. So it would be wonderful, and it'd be a cost savings to people that really need to have some flexibility in their income to do that, to have that ability. And that would reach a lot of poor older people, and that would be a good thing. Please, anyone in my group have anything that I didn't reach, please, share with me. I talk a lot. I don't want to talk a lot.
I would add only one little thing that came to me, basically, as a result of Sarah's super good idea. Sarah's had difficulty getting the housing authorities sort of in line to talk about providing the internet service in the housing complexes. I would suggest to Sarah and anybody else that if you're having that kind of difficulty, and I understand it, you might want to get in touch with somebody on the Council on Aging, and we could take it up at our meetings. We are, after all, focused on senior services. So maybe we could help Sarah, because it's a terrific idea, and it's a shame that you haven't been able to push it forward. But if there are ideas that come forth and people are having difficulty, get in touch with somebody on the Council on Aging, and perhaps we can help.
Yeah, and even at the city level, I mean, that sounds like a great recommendation and something you could apply for grant funding to do.
Yeah.
Great, thanks, Linda. So last is the health and community services. Carolyn.
Yep. So we kind of had, it seems like similar themes, and some of the other groups is really focusing on transportation, but also outreach and how do we get the information out there, especially with really all age groups. We did have a lot of high priorities in our group. I think one of the highest, really, a lot of it is access to services and support groups, mental health services, really expanding caregiver support programs are high. And then also the community hub, which not too familiar with that yet. I imagine it'd be a lot of funding for that if we haven't identified a facility, but kind of the theme was really also with that, kind of having a hybrid to that and being able to do outreach for people who can't get to there to get to that hub. I don't know if anybody else has anything to add.
One thing I'm not sure I added in the report was the memory care initiative, and I think we have a couple people who are working on that. Laura, do you want to say a little bit? And is that a limited program? Is that going to expand at some point? Is that something we should include for expansion in the report?
Love to say yes. We're currently grant funded, and we're in our third year, and we're funded by the Eisenberg Family Trust. So based on the work that we've been doing over the past 3 years, we'll certainly reapply for that funding. But I think it's key in that we are a group of collaborative community organizations, for example, Northampton Neighbors, Highland Valley, Northampton Senior Center. And we support those individuals and their caregivers
to live well in the community. We're not so much a medical model, but more of a social model. And Sharon Levinson, who's here today, is our memory care specialist. So I want to say that, yes, we could provide support across services and help to integrate both the age and dementia friendly initiatives, and, you know, assist Kathy in education and training. So there's a lot that we can do. So I hope that answers your question.
Thanks. Yeah, I just want to make sure to include it in the report if I didn't already, because I was thinking not sure I had it on the action plan.
Okay.
Okay. Anyone have anything else to add? We're at 3:20. I can. So it sounds like we got through many of the actions, but maybe not all of them. Did anyone decide on a meeting date? I know we didn't, or a meeting, good meeting time or date. Okay. Well, we have all of your contact information. I think probably what's next is I can share, I actually put the link. Let's see. All right, that's the link to the report for anyone who hasn't seen it. I'll follow up this meeting with an email. I think we can give the report a couple more weeks if anyone has anything to add. In terms of the action plan priorities, I think probably the leads can just put in priorities if you didn't get through all of them, or you know, call a meeting of your group. But I think the steering committee needs to get together and, you know, maybe decide on meeting times, and we will put those out there. Cindy, anything else? Oh, Marcia, you have a.
Yeah, I just wonder, would you include the link to the report in the email you're sending out?
Yes, I will do
Thanks.
that. And we are recording this meeting, so I will make that available. I think we could probably, we'll see if either the Northampton Senior Services can put it on their webpage, or we also, PVPC now has a website for age and dementia friendly Pioneer Valley, so we can put it on there too. Anything else? Cindy's, am I missing?
I was just going to say, I think like everyone else who's listened, there's a lot to do, and what is it? A lot to do and so little time to do it. I think for me, one of the next steps is the steering committee, because a lot of high priorities and we can't do it all at the same time. And so I think we need to take a coordinated approach, because I think we all heard, there's a lot of overlap here. So collectively, how do we maintain the energy that's around the table today and make some decisions about who's going to do what next? We definitely want to get input from the current mayor. And I think having some priorities is an important thing to present to her, so that we have her ability not only to approve it, but even more importantly, but to help provide support strategic support where necessary.
Great. Thank you. Any other closing thoughts? We're actually a little ahead of time. Yeah. Okay, well,
this is Diane from Northampton Neighbors. I have one question about this report, that the community assessment and action plan.
Yeah.
Is that something that can be shared widely with the public, or is that just for this group?
It can definitely be shared. Are you thinking that to have the public?
The reason why I ask is,
go ahead.
Yeah, the reason why I'm asking is that we have a tremendous amount of social capital in Northampton Neighbors, and people who might be interested in helping to work on this project in a more concentrated way. And perhaps offering the opportunity to read the report would pique some interest, but I didn't want to do that if it wasn't a public document.
Diane, this is Cindy.
And
I would suggest waiting I think we
Okay.
need to, it's in draft form. We need to get back to the mayor. I don't think we want
Fair
this
enough.
report to go out, but I think, and I think it's in all of our best interest to move this as quickly as possible. Because I would absolutely agree with you that sharing it more widely to get buy-in and support is a terrific way to go.
Okay, let me know when it's ready to roll and we'll make an announcement from Northampton Neighbors, okay?
It's wonderful.
Great. Yeah, and once we submit it to ARP, it'll be on their website too. But yeah, it's a great suggestion to share it widely. Because I mean, that's really a lot of what this is all about is building awareness in the community. So, okay, well, thank you all for coming. This is a great group, and we will be in touch soon and try to move these things forward. So have a good
Okay.
afternoon.
Thank you.
And to you.
Thank you.
Bye.